We're now joined via Zoom by Professor Benjamin Smart. He's the project leader of medicine and public health at the African Centre for Epistemology and Philosophy of Science at the University of Johannesburg. He will be weighing in on the significant increase on COVID-19 cases in South Africa. Prof, thank you so much for your time this afternoon. It is quite concerning that we are seeing such increases in cases and we yet to enter the winter season. How do we read into these current numbers now, Prof?
It is concerning, but it's not unexpected. I think a fifth wave was always on the cards as new variants and more transmissible variants come into existence over time. I think we're going to see more and more waves. I think really one has to look at the amount of harm that this is doing. So I think less of a focus on the number of new cases and more of a focus on the number of new hospital admissions and the number of deaths. And unfortunately, those figures are still looking pretty good relative to the earlier variants, relative to the Delta variant and the Beta variant.
Now, seeing that we may be dealing with a much bigger problem come winter, should government reconsider the easing of some of the regulations in terms of masks in schools and so forth? Because, I mean, there has been a question of, how much of the mask mandate actually is going to be of benefit, come the winter season. And of course, as this looming fifth wave just becomes even more imminent.
I think there are two issues there, really. The first is the mask issue. And in my opinion, it's not really clear what difference the masks are making. Most South Africans are wearing ordinary cloth masks. They're not being worn properly a lot of the time. They're not being washed properly a lot of the time. And whether or not we have a mask mandate in place in schools probably doesn't make too much of a difference. Particularly with these more transmissible Omicron variants. More generally, though, what about COVID restrictions in general? Do we go into a higher lockdown stage or not? And again, I think government actually have it right at the moment. I don't think we should be pushing for a higher lockdown, purely on the grounds that what's important, as I mentioned before, is not really the number of new cases, but the amount of harm that the disease is causing. And given that 50% of the population is now vaccinated and 70% of the population already have exposure to COVID-19, and potentially because of the nature of the variant itself, this disease is doing relatively little harm. I mean, we've just hit 10,000 new cases. When we hit 10,000 cases for the first time in December 2020, we had 200 deaths in a day. We only had 10. And that's not to say that those 10 deaths aren't important. Of course they are, but you have to put things into perspective. And really you measure the end of an epidemic when the harm that it causes tapers off. And that seems to be happening. So no, I don't think we should be pushing for harder lockdown restrictions.
Now, Prof, we've just heard now, US President Joe Biden addressing the second COVID-19 summit. Of course, President Cyril Ramaphosa has been invited to the summit and will be making his address, any moment from now. One of the key focus areas or key objectives of this global summit is preventing future catastrophes. Just on that point, what are some of the lessons you think have been learned, with this pandemic that will somehow take into the future to prevent future catastrophes, as it's said here?
Well, I think there are two lessons to be learned, really. The first is in terms of preventing disease outbreaks in the first instance. It's much better to prevent diseases occurring in the first place, right? On the face of it, at least, COVID-19 came about because of wet markets and the mistreatment of animals. And perhaps we can do something about that. Perhaps we can prevent the onset of the pathogens in the first instance. But secondly, in terms of managing diseases, viruses, once they actually are around, I think one thing where governments went wrong, and perhaps the World Health Organization went a little wrong this time, was a failure to take on board one of the core tenets of evidence-based public health, which is to take seriously the nature of context dependence, to take seriously the contextual conditions of the populations that you're dealing with. The World Health Organization offered really blanket advice on lockdowns for all countries. You know, it was lockdown and lockdown hard. And a lot of countries took this on board when it might not have been appropriate for them. Lockdowns themselves have, nasty indirect health consequences, direct and indirect health consequences. And, you know, we live on a continent where only 3% of the population are over 65. And where, you know, people live in very high population density areas, and social distancing effectively is borderline impossible. So, and in addition to that, you know, most people working in the informal economy, so food insecurity is a real problem. So lockdown issues hit third world countries particularly hard. And perhaps the way that we dealt with this pandemic, has caused as much harm as the pandemic itself. So I think that will be a key focus area for the World Health Organization and government moving forward.
That is very concerning in terms of what you say, that, you know, the way the pandemic was handled, probably globally, probably more so in South Africa, could have possibly caused as much damage as the pandemic itself. Now, looking at the third key objective in this current summit that's currently taking place, and as we wrap our conversation, one of the things that they've also highlighted is protecting the most vulnerable. Now, even though we are at some point of vaccinations in our country, we know that the most vulnerable, particularly that age group of 50 plus, it's still, the numbers in terms of vaccination are still very, very low. What can be done there to make sure that that age group particularly is vaccinated?
Yes, I mean, that is a real difficulty here. Vaccine hesitancy is the problem, the primary problem. We can facilitate to whatever extent we can vaccinations for everyone across the country. So obviously some people have difficulties because they live in rural areas. So we can have mobile units that help get vaccines out to people living in rural areas and so on. But I think really the biggest problem in South Africa is a reluctance to take the vaccine through misinformation and disinformation spread online. A lot of people are afraid to take the vaccine. They think that it's going to cause all sorts of health problems in and of itself. When as a matter of fact, even though the Omicron variant is benign to most people, it remains significantly more dangerous than taking the vaccine. I think that combating vaccine hesitancy is a really big issue to be dealt with. How we deal with this, it's one of the big questions, right? I don't have the answer. I mean, spreading accurate information and combating misinformation and disinformation is an important aspect of that. But the problem is, a lot of the people who are vaccine hesitant are skeptical of scientists. So when science says the vaccine is safe, they just don't believe it. But when some vaccine skeptic politician or influencer on Twitter who knows absolutely nothing about public health says, oh, it causes this, it causes that, that they're more likely to believe it. So how we go about combating that, I don't know.
Very concerning indeed. Prof, thank you so much for your time and your analysis this afternoon. Really do appreciate it.